Special thanks to the people who have made the production of the American Health Journal possible.
Toshiba Medical Systems, providing physicians with imaging tools to improve diagnosis since 1914.
This program has been presented in part by Ledesma and Meyer Construction. Building for a common vision.
And special support from Southern California Physician Magazine, the official publication of the following medical associations. Southern California Physician Magazine, the magazine physicians read.
And generous assistance from HF Healthcare, serving the hemophiliac community.
The American Health Journal, bringing you the latest information on medicine, psychology, diagnosis, treatment, and prevention. Major medical advances are made each week, and each week the American Health Journal keeps you up to date.
Hello and welcome to the American Health Journal. I'm your host, Roger Cooper. Today we have a series of reports that may help you improve your health. First up, some important information on how your kidneys work and what happens when they don't. So many people have cell phones today, but are they safe? Stay tuned for some important information on the dangers of cell phones. Also coming up, what we can do to rejuvenate the cells in our body, leading to better health.
And now back to Roger Cooper and the American Health Journal.
Over time, as we age, our body's ability to protect, repair, and replace the cells diminishes in our body. But what can be done to rejuvenate these cells? Dr. Gary L. Samuelson and Dr. Robertson Ward give us more on a product called ASEA, which maintains a balance in our body and rejuvenates the cells through redox signaling molecules. We asked Dr. Samuelson to explain what redox signaling is.
Redox signaling is a new field of science. It's only been around about 11 years. It has to do with how these little micromachines inside living cells communicate. So all of life, all of biology, all reactions take place in salt water. And so these little micromachines are allowed to alter or modify the salt water to send messages one to another. They create a certain redox potential. And these redox signaling molecules then are the things that coordinate all of the things that take place inside living cells. Almost all problems that we have, all health problems, are caused by, in some way, by damaged cells. And so if we allow the body then to go about the healing process that naturally takes place inside the body more efficiently, then we're able to affect our health.
What are the ingredients that help refurbish those cells in our body?
There are three actually areas which are very important. The first one, of course, is nutrition. The second thing is giving the body the restorative rest that it needs in order to be able to function. As the body rests, then it's able to restore itself. And the third thing is to have a proper chemical balance inside the body. This redox signaling balance that it exists is extremely important.
After 30 years in medicine, I was marveled at this new science of redox signaling, because what it revolved around was getting down to the core levels of what provides health for our body. It's not about the absence of disease, it's the presence of balance in our cells.
Every living thing that exists on Earth uses redox signaling as the mechanism to heal, repair, and replace itself. So I think that redox signaling is going to become one of the premier areas of health science and will fuel some of the greatest advancements in medical history.
Today, there is a new tool to apply, and it has to do with providing the body with a balanced formulation of redox signaling molecules. It's like providing what our cells used to be able to produce naturally when we're young. ASEA is a formulation of balanced redox molecules. It's formulated just the same way our cells formulate redox molecules. It's made from pure salt and distilled water. And through a patented process that provides a gentle electrical signal, these molecules are formulated so that at the end of the process, which takes about 3 days to make, there's no more salt. There's no more salt in water. It's a bottle of trillions of redox molecules that are in a balanced formulation, and most importantly, for the first time ever, stabilized. This bottle has a a shelf life of a year. People who applied this fundamental technology to the various cells that needed a restoration, so to speak, with this balanced formulation, they saw results. And most importantly, they saw results within weeks, not months. And that was very exciting.
Dr. Ward tells us how this product can make a difference.
If we can provide an application so we can provide balanced redox signaling molecules to a cell that is in some way working less efficiently, then everything upstream begins to work better. We have better nutrition. We have better connections between our organs and our organ systems. And cells begin to work to support one another. And so it's just opening up the magic of our body.
And that's this edition of the American Health Journal. If you have any questions about the topics or doctors that appeared on our show today, you can contact us at 1-800-303-3200. Or now, you can explore our new website, AmericanHealthJournal.com. All of our interviews with doctors with a wealth of health information can be seen there. That's AmericanHealthJournal.com. I'm Roger Cooper. Thanks for joining us.
This is an emerging science that has the potential to make a difference in the world of health sciences like nothing has ever done. And the reason is because it's working at this molecular level in our cells.